During childbirth you may tear, and about 85% of first-time mums will experience a tear of some kind. The most common tears are to the perineum, which is the bit of skin and muscle tissue that runs from the vaginal entrance over to the anus. So it's really important to take care of any perineal tears after you've given birth so that that area can heal properly. Before I share my top tips for healing after birth, I'm just going to introduce myself. My name's Anja, I'm a hypnobirthing practitioner, doula and baby massage instructor, and my YouTube channel's here to support you on your motherhood journey. If you like this video, please consider subscribing and clicking the bell icon so you don't miss my weekly videos. I bring out a new one every single Tuesday. Depending on the severity of your tear, it may take more or less time to heal, but if you follow my tips, that will help you to accelerate the healing process. Rest is obviously really important, and it's especially important in the first 6 weeks after you've given birth. So try to rest whenever you can. Now I know there's this famous phrase, sleep when your baby sleeps, but that's easier said than done. Although when your baby naps, if you have the opportunity to lie down and have a nap at the same time, please try to do that whenever you can. To help any tears to heal more quickly, it's a really good idea to let fresh air get to your perineal and vaginal area a few times each day. So take off your underwear, sit on top of a towel on your bed or sofa and just let fresh air get to your tears. It's very normal for your perineal and vaginal area to feel tender and sore, especially if you've had a tear. It's really important to keep that area as clean as possible because if it gets infected, it's going to cause you more discomfort. To keep that area clean, you can have warm baths sprinkled with sea salt because sea salt is an antiseptic that can prevent infection. It's also important to pour a jug of warm water onto your vaginal area when you pee to stop your urine from stinging any tears. It's also important to pat rather than rub those areas dry after going to the toilet. Also, make sure that you're changing your maternity pads every 4 to 6 hours. Another great tip is to lie down a few times per day because sitting down all the time is going to put a lot of pressure on your perineal and vaginal tissues. When you are sitting down, it's recommended that you sit on top of an inflatable rubber ring, a donut-shaped pillow or cushion, or a padded ring, because that can give comfort, especially if you're suffering from hemorrhoids as well. To prevent straining whilst pooping, which can put a lot of pressure on your perineal tear zone, it's a good idea to eat plenty of fresh fruit and vegetables which are high in fibre, as well as drinking plenty of water. This will soften your stools and make it easier for them to come out. Sometimes a mild laxative or stool softener may be necessary, but speak to your doctor if you think you need something more. It can also help to hold a clean maternity pad lightly against your perineal area whilst pooping to stop that area from stretching. Doing daily pelvic floor exercises after giving birth is going to stimulate optimal blood circulation to your perineal area to aid the healing process. You may want to check out my pelvic floor meditation on my channel. It does include relaxation of the pelvic floor, but it also covers pelvic floor strengthening exercises. I'll link it in the video description below. When it comes to painkillers, paracetamol is considered safe to take even if you're breastfeeding. Ibuprofen is safe to take if your baby was born full term after 37 weeks and has no medical health issues. Aspirin is not safe to take if you're breastfeeding, but it is safe if you're bottle feeding your baby powdered milk. If you're interested in more homeopathic pain relief, I recommend arnica tablets because they really helped me. I'll link the ones that I took in the video description below. I hope this video has helped. If you've got any questions about tearing, pop me a message in the comments section beneath this video and I'll reply as soon as I can. Thank you so much for watching and see you in my next video.